ladies and gentlemen. Good morning, good afternoon, good evening, wherever you are in the world today. This is The World Today, and I'm your host, Rabbi Dr. Sophia Catherine Rothschild. And with me today, we have a very special guest. We have Dr. Monica Gandhi. Dr. Monica Gandhi is a expert in the field of pandemics, and she's a professor at UCSF San Francisco. Uh, Dr. Gandhi, welcome to the show.
Thank you very much for having me.
So the many people are asking, okay, if the COVID-19 pandemic has been around with us for 2 years, could you go into detail as where are we now in the evolution of things, and what have we accomplished, what have we learned?
So, when COVID first hit, really started being described actually as early as February 2020, and January 2020 was when the virus got described, and going back December 31st, 2019, it was when it was first reported to the WHO from Wuhan, China. Really, we've come a long way since then, because there was no immunity in the population to this novel virus. It was very scary. People were not immune. It caused severe disease. And essentially what we got over this last 3 years is we got vaccines. Within 9 months of the declaration of the pandemic, which happened on March 11, 2020, we had by December 2020 effective vaccines. So we got vaccines for COVID. We got treatments for COVID, both inpatient and outpatient. And so antivirals you can use just in the outpatient setting. And not only that, but actually a lot of people got infected. Probably over 90% of the planet has seen this virus at this point by models. So there's a lot of population immunity from that. So all told, this long into the pandemic, we're in a much better phase. It's never going to go away. We still see COVID in the hospital, but it's much less severe disease. It's much more manageable. We know what to do now. And we're really in what we call this endemic phase of the virus.
So could you explain what's the difference between a pandemic and endemic?
So the pandemic phase of a virus is really when it's causing illness above and beyond what we would expect from other similar respiratory pathogens. So a good example is influenza. We unfortunately do expect a certain number of hospitalizations and deaths from influenza every year. Why? Because it's not a virus that you can get rid of. It's actually because of all the animal reservoirs, because of its high mutability or changing rate, that we're never going to get rid of influenza. So, but we do our best to minimize the severity of disease. COVID needed to get to where influenza was and other respiratory pathogens like RSV, causing the same amount of disease for the World Health Organization to declare the pandemic over. World Health Organization declared the pandemic over on May 5th to 2023, and the United States declared the public health emergency over on May 11th, 2023. Europe actually had declared the end of the pandemic phase and into the endemic phase in spring of 2022. But the World Health Organization needed to wait for China, because unfortunately China did have a mortality wave in January 2023 when they opened up, and they didn't have the vaccination rates we were hoping for. So the WHO waited for China to have its last really terrible surge, and then they declared the pandemic over. Doesn't mean that COVID is over. It means the pandemic phase is over.
Excellent. A two-part question for you here. How can one of the biggest problems has been those wet markets? That's been a breeding ground for these pandemics. What can we do about it? And also, how can we better coordinate with other countries in the world? Because the last time it was a disaster.
Yes, I totally agree that there are certain practices, like, for example, the bushmeat trade, which is a practice of hunting and slaughtering primates for food that brought HIV into our population. And then there's the wet markets that likely brought COVID into our populations. There are some things that humans do that need to be essentially banned, because what they will do is they will bring zoonotic illnesses or animal illnesses into humans, and humans haven't seen it before, and then humans get very sick. So because of that, I think that there needs to be regulation of labs, banning of wet markets, regulation, banning of the bushmeat trade. In my opinion, anything that is dangerous and brings the possibility of pathogen potential, of pandemic potential from pathogens, we need to essentially stop. And so you're right that the wet markets have not fully closed in areas in China, and we really do need worldwide cooperation to have standards of how we interact with animals. That needs to come from the WHO, in the sense that WHO is our regulatory body for world health. And I'm hoping the WHO will help in their next phase, which they're going into what they call pandemic preparedness phase. They will work on anything that is dangerous in terms of bringing the possibility of pathogens to humans from animals.
Yes. Because one of the things that we've been having problems with, also these conspiracy theories about the pandemic, and that has greatly hindered a rational response to this COVID-19. So going forward, how can we in the future better deal with this problem? And also, a second part of the question is, should we be getting the booster shots? And if so, who should?
Great. So one thing I will say is that yes, this particular pandemic had a lot more ability because of the social media presence, that people could say things that actually weren't true and get large audiences. And on the other hand, public health, and there were a lot of conspiracy theories that vaccines don't work, that vaccines were causing more illness, and it actually isn't true. Vaccines absolutely work, and they were really life-saving in COVID-19. On the other hand, I think public health could have been more nuanced on their messaging, and it relates to your next question, which is about boosters. They could have been more nuanced in their messaging to make people trust them, because right now there's quite low trust in public health authorities, about a 30% trust in the United States to the CDC. So I would say less blanket messaging and more nuance, more harm reduction, more messaging that that made sense to people. But the conspiracy theories absolutely were not true. This was a real pandemic. This did cause severe disease. Hospitals had a lot of COVID patients, and it was true. You know, this is not a hoax, and also vaccines work.
Yeah.
So in terms of that last point about vaccines, you know, I do think that the boosters have a role, but I actually think that we should be more subtle and more nuanced about our booster recommendations. The World Health Organization, the UK, and most European countries are recommending the booster for those who are older, usually 65 and older, those on immunosuppressants for another condition, or those with multiple comorbidities. And I think that that's right. That's the populations that really need the booster most. We really are in a phase where a lot of us have immunity, where a lot of people got 2 doses, and that immunity really does work and have kept people out of the hospital. So because of that, I would recommend the booster for those 3 groups. You can certainly get the booster if you're in another group, but I would really, if I were in charge of the world, I would target our public health messaging towards the highest risk groups at this point, and it's the older immunosuppressants, those with comorbidities.
Oh, excellent. I'm also amused by all the individuals with no medical training on TV talking nonsense. We can talk about, I'm not going to call any names, but I think we all know who they are. They talk about, it doesn't work, but yet in private, they get they get the vaccine.
Yes, that's actually a really interesting point, that we made the vaccine this strange partisan issue in the United States, which isn't usually how vaccines work. And I think it's just really important to say that that vaccines do work, that people have been getting them, even if they're not saying they're getting them. And the vaccines were developed under a Republican presidency, let's be fair. Operation Warp Speed was funded in the prior administration and continued in this administration. So vaccines should not be a partisan issue.
Yeah, exactly, indeed. And going forward, what are some of the things that we can implement in order to deal with the next pandemic? Because that's very critical. I know you wrote a book about it. Could you talk about some of the steps we can make to make sure that we are better prepared for the next pandemic coming up?
Yes. So, I did write a book. It's called Endemic, a post-pandemic playbook. It's published by Mayo Clinic Press. Came out in July, and it really is to prepare us for the next pandemic, including bringing up our trust in public health. It's a model of pandemic preparedness that uses concepts of harm reduction, figure out how to use biomedical advances, which are vaccines and therapeutics, celebrate them, encourage them, but also minimize harm of interventions that don't do much to control the pathogen and cause harm. And that would be, for example, closing other medical care or prolonged school closure. So it's really a step by step. There's a 10-point plan at the end of the book of how to increase trust in public health, maximize vaccines, global equity in vaccines, don't close the outside, don't be coercive, use education, reassess testing practices as we go along, really bring up antivirals because they're important for non-eradicable pathogens. We need both vaccines and antivirals. And then we're in this phase of we need more trust, bringing up trust, saying what went wrong, say what went right. And that's what the book is about. And I hope that we can go forth with more trust in our public health authorities. And I hope that we don't have to deal with another pandemic for a very long time.
Awesome. Because and then this is gonna be my last question here. Should there be like an entity that coordinate all the different states, locally and nationally, in dealing with pandemics? Because the last time we had this chaos, and this state was doing this thing, and the other state was doing another thing, and people are dying in the process, and that's really really sad. So could you, in closing, talk about that?
Yes, we are really fragmented response. Part of actually this book is I do advocate for a universal healthcare system because I think that countries that had universal healthcare did better. I think that healthcare is a right, not just a privilege, but an absolute right. And so in the context of a universal healthcare system, I think we would have done better and we would have had more standard protocols. I will say that in terms of plans for the next pandemic, I would defer more to the WHO than we did. We ignore the World Health Organization in many ways. The entire point of the World Health Organization is to come up with unified plans to do global surveillance. One place in the world is affecting another place in the world, so that I hope that we give the WHO more respect, more funding. We buy into their pandemic plan, and which they're developing right now with a lot of input. And I really hope that we won't be so fractured like we were this time.
All right. Well, thank you so much, Dr. Monica Gandhi, for taking the time to speak with me today. And once again, could you remind us of what's the name of your book?
Thank you. It's called Endemic, 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 and it is published by Mayo Clinic Press. Came out in July of 2020.
All right. Thank you so much. And
thank you very much for having me. I appreciate it.
Thank you. Bye bye now.
Thank you. Okay, bye.
Yeah.